Resuscitation adjuncts, AEDs. The heart is a muscle with 4 hollow chambers that pump blood throughout the body. An electrical conduction system coordinates its regular rhythmic action. Complications from heart disease or other sudden events like electrocution may disrupt the heart's normal electrical activity. The result is abnormal heart rhythms, disrupted circulation, and potential cardiac arrest. The 2 most common abnormal heart rhythms are ventricular fibrillation, or VFib, and ventricular tachycardia, or VTach. Ventricular fibrillation is chaotic, uncoordinated electrical activity. VFib results in quivering of the ventricles instead of strong, regular contractions. Ventricular tachycardia means the heart beats too fast. In VTach, the heart beats at such a rapid rate that it cannot pump blood effectively. Because both VFib and VTach respond to defibrillation, the earlier an AED can be used, the greater the chance a patient will survive. Automated external defibrillators, AEDs, are devices that analyze the heart rhythm, determine the need to shock, and deliver a shock through cables and pads adhered to the chest. Types of AEDs vary from basic units that laypeople can operate to AEDs that have more advanced features helpful to healthcare providers. All AEDs have common features, including the ability to turn the unit on and off, cables and electrode pads to attach to the patient, voice prompts such as "stand clear" to guide users through the procedure, and the capacity to analyze the heart rhythm, deliver a shock when needed, and store and retrieve data.
Do not touch the patient. Analyzing heart rhythm. Please wait. Shock advised. Do not touch the patient. Shock will be delivered in 3, 2, 1. Shock delivered. It is now safe to touch the patient. Start compressions.
AEDs are simple to operate. With only a few buttons and voice prompts as a guide, using an AED is easier than giving CPR. Regardless of the AED make or model, all units follow the same basic steps. Turn the device on. Apply electrode pads to the patient's bare, dry chest. Analyze the heart rhythm and deliver a shock if needed. AEDs can be used on patients of all ages, from infants to adults, as long as the patient is unresponsive, not breathing, and without a pulse. Perform CPR until an AED is ready to be applied according to your protocols, and then follow the prompts. It may be necessary to use a razor to remove excessive chest hair so that the electrode pads properly adhere to the chest. Perform 2 minutes of CPR immediately following the administration of a shock. Whenever using an AED, follow the established procedure for your device. Some devices are semi-automatic, requiring you to push a button to administer a shock. Other devices are fully automatic and administer the shock. You should be familiar with the operation of your specific AED so you recognize its prompts and can check or correct unexpected messages. Some of the prompts your device may provide include a "no shock" advisory, analyzing interrupted, check electrodes, and replace battery. Using an AED requires awareness of some special situations so you can take appropriate precautions and action. These special situations include use of AEDs around water, the age of the patient, trauma, and patients who have medication patches or implanted defibrillators or pacemakers. Whenever the patient is near water, quickly move the patient out of standing water, dry the chest, and apply the electrode pads. As long as the chest is dry and the pads are firmly attached to the chest, there is little risk of any shock to the healthcare provider. Cardiac arrest in children is usually caused by an airway obstruction or breathing problem. AEDs can safely be used on children. If your device has specialized pediatric pads, use them. If such pads are not available, you should use the regular adult pads. Cardiac rhythms like VFib or VTach are rarely present in cardiac arrest from trauma. Trauma victims need immediate transport to a trauma center. The cause of cardiac arrest in victims of trauma is not usually associated with the kind of heart rhythm that would be helped with an AED. However, when in doubt, it is better to use the AED than not. No harm will be done by using the AED, but it would be highly unusual for a trauma victim to be saved by the device unless the cause of the trauma was originally a sudden cardiac event. If medication patches are on the chest, remove the patches and wipe the skin clean before attaching the AED electrode pad. Modern pacemakers and internal defibrillators can withstand the shock from an AED without problems. If you notice an implant like a pacemaker or defibrillator, apply the pads at least 1 inch away from the implanted device. Inspect your AED periodically to ensure that it will function properly and that you will have the supplies you need whenever you respond to a cardiac emergency. Supplies that you should periodically check include unexpired electrode pads and fully charged battery, a razor for shaving a victim's chest before attaching electrode pads, and a towel to dry the chest if necessary. AEDs run their own internal diagnostics to make sure the device is working properly. Each AED has its own unique way of indicating to the user that it is ready for use.